Ever feel like your body is rebelling against you and no one can figure out why? You're tired all the time. Your weight won't budge. Your mood is all over the place. And yet, your doctor says your labs look normal. Sound familiar? Well, what if the real issue is your thyroid? And what if there's a whole lot more to the story than anyone's told you? Today's episode is going to connect the dots in a way that just might change everything. Welcome to the Feel Better, Live Free podcast brought to you by Thinlicious. I'm your host, Ruth Sukup, and here we'll talk about everything from the science of weight loss to practical tips for making your health a priority in the midst of a busy life. It's a little bit nerdy, a little bit funny, and a little bit revolutionary. So buckle up, friend, because it's about to get real. Hey there, and welcome back to the Feel Better, Live Free podcast. For those of you who don't know me, my name is Ruth Sukup, and today we're chatting with Dr. Eric Osansky, a chiropractor, clinical nutritionist, and certified functional medicine practitioner who specializes in thyroid and autoimmune thyroid conditions. After overcoming Graves' disease himself using natural therapies, he's made it his mission to help others do the same, focusing especially on hyperthyroidism, hypothyroidism, and autoimmune issues like Hashimoto's. He's the author of multiple books, including Natural Treatment Solutions for Hyperthyroidism and Graves' disease and Hashimoto's Triggers, and he also hosts the Save My Thyroid podcast. In today's conversation, we're talking all about the thyroid, what it actually does, what throws it off, and how to support it naturally, especially if you're a woman over 40 dealing with hormone imbalance, fatigue, or stubborn weight. It's definitely interesting stuff. So let's get right into it. Dr. Eric, thank you so much for being here today. I'm so excited to talk to you.
Thank you so much, Ruth. I appreciate you having me, and I'm excited as well.
Awesome. Well, I always start with the same question for all my guests, which is tell us a little bit about yourself, who you are, what you do, and how you got to be doing what you are now.
Yeah, so my background is a chiropractor, and I was practicing traditional chiropractic for about 7.5 years, and I was diagnosed with hyperthyroidism, which was a complete shock to me, and just didn't have experience at that time dealing with hyperthyroidism. And then eventually I saw an endocrinologist, was diagnosed with Graves' disease. And even though I didn't have experience as a chiropractor, we have to take our continuing education credit. So I always took nutrition and functional medicine seminars, and I took a few functional endocrinology seminars, and they actually spoke a little bit about hyperthyroidism. Of course, the focus was more on Hashimoto's because that's more common, but they gave some natural solutions, natural approaches for Graves and hyperthyroidism. So when I was diagnosed, I didn't really know much, but I knew I was going to at least try to address this naturally. And I was successful. Long story short, I was able to avoid the medication that a lot of people take, including a lot of my patients. So there is a time and place for the medication, but I was able to avoid it, was able to restore my health. And after that, this was in 2008 into 2009, I just realized that there's a lot of people out there with thyroid and autoimmune thyroid conditions. And so since then, I've been helping others, many people with Graves and hyperthyroidism, even though I also wrote a book on, I wrote two books on hyperthyroidism, one on Hashimoto's, as you know. So I see a mix, but I'd say I see more people with hyperthyroidism Graves just because there's not a lot of practitioners out there that see them. So, but that in a nutshell is my background.
Okay, interesting. So why don't we start with just like a little bit of clarification on hypothyroidism and Graves versus Hashimoto's, like what's the difference? Because I don't think I know what the difference is between all of those things.
Yeah, great question. So hypothyroidism, yeah, so hypothyroidism versus hyperthyroidism. So with hypothyroidism, we have thyroid hormones, T3, T4, the main thyroid hormones, And then we have what's called TSH, thyroid stimulating hormone, which is actually a pituitary hormone. And so with hypothyroidism, we typically have those thyroid hormone levels either on the lower side or overtly low, like below the reference range. TSH communicates with the thyroid gland. It tells the thyroid gland, in this case, when thyroid hormone gets low, you want more TSH because you want the thyroid gland to produce more thyroid hormone. So you see that increased TSH. So again, that's hypothyroidism in a nutshell: higher TSH, lower T3, T4. And then hyperthyroidism is the opposite. So with hyperthyroidism, we have elevations in T3 and T4. So too much T3, T4. And as a result, the pituitary gland is telling the thyroid gland, let's stop producing thyroid hormone. So there's very little TSH. And in the case of Graves' disease, which I'll talk about in a few seconds, you have usually undetectable TSH, like less than 0.01, for example. And yeah, so what's the difference between Graves and Hashimoto? So most thyroid conditions are autoimmune in nature. So most people with hypothyroidism have Hashimoto's, and most people with Graves' disease, I'm sorry, most people with hyperthyroidism have Graves' disease. And the main way you tell is by testing the antibodies. There's different types of thyroid antibodies. The most common thyroid antibodies are thyroid peroxidase or TPO antibodies, which are more commonly associated with Hashimoto's, even though a lot of people with Graves have those antibodies as well. Then there's thyroglobulin antibodies, which are definitely more common and more commonly associated with Hashimoto's. And then the antibodies associated with Graves are thyroid stimulating immunoglobulins, or TSI, which is a type of TSH receptor antibody. And so when you have those antibodies, the Graves antibodies, the TSI, those are stimulating the TSH receptors to secrete thyroid hormone. Again, too much thyroid hormone. And then what Hashimoto's, it's more of a damaging condition. The immune system is damaging the thyroid gland, which over time leads to the lower thyroid hormone levels.
Okay. So one is basically too much and one is too little, to sum it up.
Exactly. You got it.
Okay. So then I would assume that the symptoms are totally different from those two things.
Yeah, you would be right. Yes. So symptoms like with with hypothyroidism, because thyroid hormone is associated with the metabolism, typically when you have low thyroid hormone, you're going to get fatigue, you're going to get weight gain, you'll get brain fog, you'll get coldness, you'll get constipation. So think about it as everything slowing down. And
Mm-hmm.
then with hyperthyroidism, so like when I dealt with hyperthyroidism and Graves, I had increased resting heart rate, so tachycardia, had heart palpitations, had some tremors. Anxiety. I didn't have anxiety, but anxiety is pretty common. I experienced weight loss. I was trying to lose weight, but I lost 42 pounds, which I wasn't trying to lose. I was down to 140 pounds, which was definitely lower than I wanted to be. So weight loss is pretty common. Uh, I mentioned coldness with hypothyroidism, so heat intolerance more common with hyperthyroidism. I mentioned constipation with hypothyroidism, loose stools, diarrhea with hyper, and their hair loss is pretty common with both. Any type of thyroid hormone imbalance can result in hair loss. And then I guess one other thing that worth mentioning is with Graves' disease specifically, there is something called thyroid eye disease, and that's when the immune system, the same immune system involved in Graves' disease, attacks the tissues of the eyes and could lead to symptoms such as bulging, swelling, double vision. And so that's pretty common with Graves. But those are pretty much the differences in symptoms between hypo and hyper.
Huh. So, which it makes sense that they would be completely opposite if they're like it's two ends of the same spectrum. So in the middle then is your perfect thyroid, right? So let's back up and go there because I want to understand like what is the role of thyroid in your body and what is like give me the ideal situation. Like what is the role of it? What does it do? How does it function in your body? What is it affecting? So why is this such a big deal? If I've learned anything from my own health journey, it's that real transformation isn't about finding one magic diet plan. It's about finding the best food to nourish our bodies every day. And that's why I am so excited about Seven Sons Farms. Just like me, their family story started with a mom's health struggle, and it completely transformed the way they raise food. Today, they're delivering pasture raised meats and eggs straight from their farm to families across the country, which makes it easier and more convenient than ever to eat the healthiest, highest quality meat in the country. And here's the best part. If you want to try it for yourself, Seven Sons is giving my community an exclusive $50 off your first box. Just use the code TL50 at checkout. You'll find the link in the show notes.
Yeah, great question. I mean, so thyroid hormone affects every single cell, tissue in the body. I mentioned it's really known for metabolism to help balance. Like if someone has hypo, again, they have the lower metabolism, and then hyper, it's increased. So, which you don't want either one. But it also affects other areas of the body, like the heart. So if you have, again, I mentioned how I had elevated heart rate. And then with hypothyroidism, a lot of people have low heart rate, also affects blood pressure, bone density. So with hyperthyroidism, it increases the bone turnover. And so you increase risk of developing osteopenia, osteoporosis. With hypothyroidism, it seems like it affects more of the bone quality. Cholesterol, so like cholesterol metabolism. So with hypothyroidism, a lot of people have high cholesterol, so which is frustrating because many doctors, when they do a lipid panel and you see high total cholesterol and LDL, they might not even look at the thyroid. They'll just say, "Oh, you have high cholesterol. Let's put you on a statin, for example."
Yeah.
And yeah, and then with hyperthyroidism, we see the opposite many times, where cholesterol is actually low. And some doctors would say, "Hey, that's good. You have low cholesterol, but you don't want it too low because cholesterol is important. It's a precursor to like our sex hormones and steroid hormones." I mean, thyroid hormone affects the brain. It affects gut motility. I mentioned again, like if you have too low thyroid hormone, again, you might have constipation, and if it's too high, the loose stools, diarrhea. So, yeah, I mean, so if it's out of balance, it's gonna again
Big deal.
it is, and so
And you'll
obviously
feel
if
it.
yes. Well, most of the time you will. The thing is with hypothyroidism, it's a slow process. So with Hashimoto's, it could take 10, 15 years for, I mean, usually you're going to feel some symptoms before then, but it's definitely a slower process. With Graves, the symptoms are more noticeable. So if you have anxiety, elevated heart rate, palpitations, usually it won't be years. With hypothyroidism, the problem is not that you don't get symptoms, but like if someone gets fatigue or gaining weight, they might dismiss it and say, "Oh, maybe, I just need to change my diet and sleep better and I'm working too hard." And again, not really think about their thyroid.
Right. Well, I was getting, it's funny you would say that because I was going to ask, it must have come on for you relatively quickly if you were trying to lose weight and then all of a sudden you lost too much weight. Like what was there something that triggered it with Graves' disease? Does it get more triggered unlike Hashimoto's? Because I know people who have like lived with Hashimoto's for years and years and years, and it's like this kind of ongoing long thing. And yet, what you're saying is that it became this like sort of immediate thing that you needed help for because you felt
Yeah,
it right away. So how
yeah.
does that
So
work?
yeah, so I mean that's another great question. So with Graves, I mean, I mean it's I mean with autoimmunity, the immune system component, like the autoimmune component happens before it affects the thyroid. And um, with Graves, it's definitely a quicker process. And with me, I'm pretty sure stress was a big factor, and it wasn't just emotional stress. So I mentioned how I was trying to lose weight, and one way was by, dieting, just restricting calories, things I shouldn't have been doing. But so that's a stressor. But I was also overtraining, so I wasn't listening to my body. And so I think the combination of overtraining and again the caloric restriction. I mean, now you hear a lot about intermittent fasting, which is again, there's definitely benefits of that, but you could be extreme when it comes to
Yeah.
intermittent fasting even. And then the exercise, I'm sure you encourage, your clients to exercise, your listeners to exercise. But again, you don't want to overdo it. Yeah, exactly. You want to listen to your body. And I should have known better with my background
Yeah.
as a chiropractor. But again, I was just determined to lose weight. And I wasn't I was 182 and just was trying to get down to like 165-ish or so. And,
Yeah.
just like I said, so stress.
You
I,
took
I'm
the man approach. Like, I'm just going to power through it.
Pretty much, yeah,
Such a man
exactly.
thing to do.
Yeah. Yes. But I also should add, I did an adrenal saliva test because I was in denial. Like the question is, how did I know it was stress related? Because honestly, I wasn't really making that connection right away. But I decided to do an adrenal saliva test, and everything was in the tank. The cortisol was low, DHA was low. There's a marker, secretory IgA, that was low. And
Interesting.
so seeing is believing. When I saw that, I
Yeah.
was realizing, yeah, okay, stress definitely was at least a factor.
So then did you self-diagnose? Because had you heard about Graves' disease before? Was this something you were familiar with before you got diagnosed or not? Not really. Did you end up having to get outside consultation?
Yeah, no, I did go to a primary care doctor because again, I learned about Graves prior to being diagnosed, but I really didn't have experience with it. So when to backtrack, the reason, like the weight loss, I should have caught on, but I was just thinking, oh, the diet's working great, and again, it wasn't like I was down to 140 in like a month or two, so I was just gradually losing weight. I was had increased appetite, which is also common with hyperthyroidism. But again, I just attributed that to the diet. But one day I was walking around a retail store, a Sam's Club, and they had one of those automated blood pressure machines. And I took my blood pressure, which was normal, but my resting heart rate was 90. And then I just took the next few days because thinking, hey, maybe just because I was walking around the retail store, but it was anywhere between 90 to 110 beats per minute. And that's when I was like, something's wrong because my heart
Yeah.
rate is not that high. Then I did go to a primary care doctor who ran some blood work, some basic blood work, and diagnosed me with hyperthyroidism. And at that point, I probably could have done the testing for Graves, but I guess just because I didn't have the knowledge that I had back then, I didn't have the knowledge then that I have now. I just wasn't sure. So I did see the endocrinologist, which I only saw her one time just to get the blood work and get the antibodies, which again, knowing what I know now, I could have done that on my own, but I did see her and also got a thyroid ultrasound, and the ultrasound looked okay, but the thyroid antibodies for Graves were definitely elevated, and that's how I got the diagnosis. So I did see someone else to get that diagnosis.
So then once you got the diagnosis, then was it like immediately I'm going to go on medication, or were you with your background as a chiropractor like, no, I'm going to deal with this naturally, and like what was your next step?
Yeah, so I was stubborn when it came to the medication. Like I was open to doing it, like if I was open to taking it, but again, when I took those continuing education credits, the functional endocrinology seminars, and I learned that there were natural herbs, specifically bugleweed and motherwort, which you might have never heard because they're not too popular, but and I didn't hear about them until I attended that conference either, but I knew about them just because of that conference. And again, I had no idea if they would work. So, because I had nobody else who was who dealt with Graves in the past. But so I figured I'd at least give it a try, give it a month or so. And because, yeah, the endocrinologist definitely recommended antithyroid medication. I didn't mention anything to her about the bugleweed or motherwort in my background, so and like I said, I just saw her that one time to get the diagnosis. If I needed the meds, then I guess I would have had to continue seeing her. But I figured I'd give it a try. So I took the bugleweed, and within a few weeks, I noticed my heart rate decrease, my like resting heart rate decreasing. I still had some palpitations, and that's when I added the motherwort, and that helped further. And then through follow-up blood work, I just saw that the numbers started heading in the right direction. And I mean, the thing is, bugleweed and motherwort, they're not addressing the cause of the problem. They're just more of a natural way of managing the symptoms. And so while doing that, that's when I was like changing my diet, managing my stress, and just taking supplements and just diet, lifestyle, supplementation, just trying to restore my health essentially.
Right. So how long did it take for you to go from like, ooh, this is crisis or this is not good to back to like normal levels where you were feeling good again? Not that long, it sounds like.
About 9 months.
Oh, okay.
Once I started the change, like, because when I went to the primary care doctor, it was a few months before I saw the endocrinologist. And again, knowing what I know now, I should have done things in between there. But no, I was like, I'm just gonna feel sorry for myself and wait until the endocrinologist appointment and get that
Isn't
official
that so
diagnosis.
funny? That's so funny. Like, but that's such a classic response. And I think that like I don't know, hopefully there's many takeaways from this episode, but I think that's one where like even when we know what we're supposed to do, we don't do it, right? Like that's just like such a human nature thing to do that you really have to like force yourself sometimes to step outside of the like, oh well, I guess this is just the way it is, and go, wait, no, I don't have to accept this.
Yeah.
I can, there's something that I can do. But I love that you're sharing so honestly. So thank you for being honest about all this.
Yeah, you're welcome.
So I have a few follow-up questions. One is about like food and what do you eat, but I want to go back to the difference between Graves and Hashimoto's or hypo and hyperthyroidism,
hmm
and just clarify like what percentage of people are dealing with thyroid issues, like in your estimation, and what is the percentage of hypo versus hyper?
Yeah, I mean, I think the numbers for Hashimoto specifically is 8%, at least those that are like diagnosed of
Of
the
the total
population.
population?
That's yeah. And
That's
with
high.
it's
That's a
pretty high.
lot
I
of
mean,
people.
it's the most common autoimmune condition out there, so it is pretty
Wow.
common. And that's again, that's diagnosed. So apparently, there's a lot more people out there who have it, and they just don't know it. And not all medical doctors look at antibodies just because their approach won't change. Either way, they're going to give thyroid hormone replacement regardless, and not doing anything for the immune system. For Graves. I've heard numbers like 1%, which is still kind of high when you think about it, like of the total population. What like non-autoimmune hyperthyroidism and Hashimoto's, I mean, I mean, supposedly 90% of Hashimoto's or hypothyroidism
It's
patients have
Hashimoto's.
Hashimoto's and similar with Graves. So probably not much higher as far as like those who have like non-autoimmune hypothyroidism, non-autoimmune hyperthyroidism. The
Uh-huh.
number's probably maybe a little bit higher than the 8% and the 1%. But again, since most people with thyroid conditions have an autoimmune component, I mean, that's fairly representative of yeah, like I said, with some exceptions. There's certainly people, I mean, I work with people who have like multinodular goiter with no autoimmunity, and they have like multiple thyroid nodules in the presence of a goiter. So there are people with, and then congenital hypothyroidism, but again, it's a much smaller percentage.
Interesting. Okay, so I want to touch on something you just said, kind of in passing, but I think we need
hmm
to dig deeper there. So you said that when doctors are mostly just kind of going, they're not dealing with the autoimmune component, they're just going straight to the thyroid hormones and adding and medication. So how does your approach differ from that? And what does that look like? Like what are the alternatives? I guess if hypothyroidism and Hashimoto's is this common, 1 in 8, and I think you can correct me if I'm wrong, but I think it's far more common in women than in men. Is that correct?
Yes,
So if it's
correct.
8% of the general population, then it's probably higher than 1 in 10 for women.
Yeah, I think I mean, safe to say yeah, and again, we're talking about diagnosed cases and who knows how many undiagnosed cases.
Right.
So yeah, you're right. As far as the approach, I mean, again, there's time and place for thyroid hormone replacement, just like there's time and place for anti-thyroid medication, but that's where it stops with these conditions when going to an endocrinologist. Now, what Graves' a little bit different because there's also these. It's not just medication. Sometimes I'll recommend thyroid surgery or radioactive iodine that destroys the cells of the thyroid. So that's pretty extreme. So my number one goal, at least for those with hyperthyroidism grays, is to try to prevent people from having to get the radioactive iodine thyroid surgery because if you get your thyroid taken out, there's no turning back. Um, but like I said, there's a time and place for the medication. But even if someone needs the medication, we want to address the autoimmune component. And how do we do that? I mean, there's what's called a triad of autoimmunity, three components necessary for autoimmunity to develop. Genetics is one component, which of course we can't change the genes, we can change expression of genes, but thankfully the other two components we can modify, which are exposure to one or more environmental triggers and an increase in intestinal permeability, also known as leaky gut. And so that's my goal is to try to find, remove the triggers, heal the gut, correct other underlying imbalances like nutrient deficiencies, and make it sound easy, but it's definitely complex. And I mean, just making those changes, making dietary changes, blocking out time for stress management for a lot of people is definitely, and it was for me too. I was no exception when I dealt with Graves.
Right.
But, again, the sad part is most doctors, especially endocrinologists, just dismiss diet and lifestyle. So, like, if
Mhm.
you ask them, will it make a difference if I change my diet, if I manage my stress better, get more sleep, incorporate more movement, like incorporate the foundations, essentially, most of them will say, absolutely not. There's really nothing you could do except take the thyroid hormone replacement, take the levothyroxine, take the antithyroid medication.
Yeah. Yeah. Yeah, they like those pharmaceuticals. Uh, I feel like the conversation is changing though a little bit. Like, not enough, but I feel like we're
I,
maybe
I
moving in the
agree.
right direction a little bit.
Yeah, there.
And especially just kind of like with this new administration
Mhm.
and getting RFK Jr. in there and stuff. Like they're at least opening the door for something that's not just big pharma, big pharma, big pharma. I
Yeah,
don't think
I
it's there
agree.
yet fully, but I'm
Yeah,
hopeful. I'm hopeful.
same here.
So, okay, so diet and lifestyle are the biggest changes. So let's just back up a little bit more. Sorry, I keep going back to the
No,
remedial
that's
questions. I
okay.
feel like I'm in the remedial class for thyroid, but I want to make sure that it's clear. So when you talk about autoimmune, what does that actually mean? Like that gets thrown out a lot, right? Is the autoimmune, 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 but what does that actually mean? This is an autoimmune condition and that has what caused that. So what is what does that mean?
Yeah, so I mean, there's a lot of different autoimmune conditions, and that essentially means that the body mistakenly attacks itself. So, in the case of thyroid autoimmunity, the immune system is attacking different parts of the thyroid gland. So, with Graves, it's the TSH receptors, and that's what causes the excess production of thyroid hormone. For Hashimoto's, it's attacking other parts of the thyroid gland, which results in damage and over time could result in hypothyroidism. And then you have other autoimmune conditions like multiple sclerosis, where you have autoimmunity, the immune system attacking certain areas of the brain, and rheumatoid arthritis, where the immune system is attacking the joints. And again, it ties into the that triad of autoimmunity. Um, but again, you got to dig deeper. It's like, why do we see more autoimmune conditions now, like compared to 10 years ago, for example, and 15 years? And I mean, one of the big reasons is our toxic environment is just getting worse and worse, and
Yes.
just and so that's a huge reason in my opinion. And it's in the literature too. It's not just my opinion. I mean, you just look now, even things like microplastics that everybody's talking about. Again, it's in the literature. It's not just crazy functional medicine doctors talk about
Right.
microplastics. It's now even medical doctors who practice functional medicine are aware of the research and
Yeah.
but yeah, just so many different toxins. I mean, there are other things like infections and again, what you mentioned, food and stress but again, I think the number one thing is our toxic environment, which not only affects our immune system, but a lot of these things are endocrine disruptors, which can potentially also directly affect glands like the thyroid.
Oh, interesting. Yeah, and I was thinking about that. Like, I feel like we're still at the point in history where we don't have enough hindsight to be able to like really pinpoint stuff. I mean, I think we're getting closer and closer, right? Like you can very clearly see if you look on the charts of health and longevity and disease, that how much of it corresponds with like high fructose corn syrup and seed oils, right? Like the advent of those in the 50s and 60s, and this whole switch to like low fat everything and processed foods. I mean, that very like you can see it in the charts. There's a very clear correlation. And I wonder too if we will also be able to see that further in the future with like the advent or the increase in popularity of plastic water bottles and right, like all this stuff
Yeah.
that we don't really think about, right? Like water is healthy and drinking water and having a million water bottles every day. Like, but what are we putting in ourselves? I wonder if like 50 years from now or 100 years from now, we'll be able to look back and go, oh my gosh, what did we do to ourselves? I mean, I feel like I'm a little bit at that point now, but I don't think that's the general, that's not like the world isn't there yet. So
Yeah.
I don't
Agreed.
know. So what do you do, right? Like let's talk about solutions of what are the steps? If you're listening to this thinking, oh my gosh, I think I have a thyroid issue, then what do you do?
I mean, step number one is to have the proper mindset, just because if you don't believe in a natural approach, if you don't, I mean, again, it's hard to be positive when you're dealing with Graves or Hashimoto's or even a non-autoimmune thyroid condition, but I think that definitely was helpful in my situation. It's like I was motivated, I was positive. I mean, some of me was skeptical because again, I didn't know of anybody who had Graves, but still I, I knew there was a cause to the problem. So having the positive mindset. Number two, you do want to be safe while addressing a cause. So that's why, I mentioned there is a time and place for medication for both hyper and hypo, Graves and Hashimoto's. So again, there's natural solutions like I mentioned earlier. It's for symptom management while addressing a cause. But again, either way, you definitely want to be safe. And then the foundation. So everyone listening could clean up their diet, eat whole, healthy foods, avoid refined foods and sugars, drink water that's not out of the plastic bottles, as you just mentioned, and just yeah. And then stress management, blocking out time for stress, I think on a daily basis is a good idea. And I mean, it's great when someone says that they're doing yoga like 2 or 3 days a week, but I think we really got to do some type of mind-body medicine on a regular basis. And of course, working on sleep, regular movement. But as I mentioned earlier, you don't want to overdo it. You don't want to underdo it, but overtraining. Those are the foundations. I mean, I guess included with that now as a foundation is reducing our toxic burden. I mean, there's definitely more advanced things that we could do, but just trying to minimize. I mean, again, getting back to the plastic water bottles, we could just get our own filter and filter our water or drink Mountain Valley Springs, which is spring water out of a glass bottle, and just try to at least minimize if we're out on vacation. Again, the time and place, but if you're every single day drinking out of plastic water bottles, or again using a lot of chemicals in your home, just cleaners and cosmetics. So those are things that you could change, and it doesn't mean you have to change all of them at once. Maybe just start with one or two products you're using on a regular basis,
Yeah.
and yeah, and then functional medicine testing. So I do recommend testing usually to find triggers and underlying imbalances. Things like adrenal testing, hormone testing, sometimes gut testing. I mean, there's a lot of different functional medicine tests, organic acids testing, mold testing. It really depends on the person. I mean, there are some tests like adrenal saliva testing or Dutch testing that I recommend for most people, one or the other, not necessarily both. But then other tests might be like if someone's having a lot of gas and bloating with certain foods, maybe we do a test for small intestinal bacterial overgrowth, or maybe we do a comprehensive stool test. But that's also part of the process. You could do a lot by incorporating those foundations I just mentioned, but I find that many times we do need to dig deeper.
Hmm. So do you find that with your patients that you're able to reverse the symptoms of either hyperthyroidism or hypothyroidism pretty pretty effectively without medication, or does it like what kind of percentage is there? I mean, how somebody's thinking, oh my gosh, especially like for Hashimoto's, 10% plus of women are dealing with that right now. What is the percentage that are going to be able to effectively manage that by managing stress, by changing their diet and healing their gut versus like, nope, you can't, you need to be on medication.
I mean, most people can, I mean, I'd say like 80, 90% of people could, I mean, because we'll talk about more about the autoimmune component than the symptom management. Like, just to give an example, with hyperthyroidism, not everybody could use bugleweed and motherwort. I find maybe like 70%, 75% could use the natural agents as a form of symptom management, but there are definitely a lot of people that need the antithyroid medication. But regardless whether someone needs antithyroid medication for Graves, let's say, or thyroid hormone replacement for Hashimoto's, a good number of those people we can reverse the autoimmune component. I mean, again, it's not easy necessarily to do that, but it can be done. And Hashimoto's also is a little bit different, and then in that there's damage to the thyroid gland, and so if someone's on thyroid hormone replacement, it's not like they absolutely can't get to the point where they're not taking it, but
Mm,
there are people that do need thyroid hormone, that it's more difficult, especially if they've been on higher doses of thyroid hormone for a long time, then they might need to continue taking thyroid hormone. Again, maybe they'll switch to a different type because a lot of people are on Synthroid, and again, a lot of people, I mean, some people do okay with that, but some others do better with like desiccated thyroid or compounds of thyroid hormone. But as far as addressing the autoimmune component, I mean, most people, it can be reversed. It's just really coming down to finding the triggers, removing the triggers, healing the gut, which again, I know I make sound easy. So like I said, it doesn't
right.
mean it's an easy process, but given a choice
It's so
to
possible.
not do what, just take the medication. And one other thing I'll mention is if you, let's say all you do is take thyroid hormone replacements or antithyroid medication, the research clearly shows that if you have one autoimmune condition, you're at greater risk of developing other autoimmune conditions. So
Right.
that's the concern if you don't do anything to improve the health of your immune system.
Right. Which makes sense. And I think it comes back to this all the time on this podcast, right? Because we're talking about all these different topics from different areas, whether it's gut health. I had somebody on a few weeks ago. She was talking about toxins in your clothes and how that affects your endocrine system, right? Like you don't even think of. I'm like, now here's a whole new thing to worry about.
Yeah.
But I think like something that comes back to me all the time is number one, that almost everything that's wrong with you right now is reversible through diet and lifestyle changes. Like it's just a matter of saying, no, I still want to eat this garbage. And I still want to because I'm so attached to all the garbage that I am eating, that bag of Doritos in the pantry, that I can't stop eating it, and I'm not going to change. I'm not going to change my lifestyle, right? Because it comes back to that. But then it's the question of, do you want to feel like crap or do you not want to feel like crap? Because so much of this is reversible. And then it also comes back to, I think that there's like the big things that you can change. And then there's like you can start to pile onto that, but you don't have to do everything all at once, right? Maybe it starts with changing your food. And then it's okay, now I'm going to start getting rid of microplastics in my kitchen and all of those plastic containers that I'm using. And then no more candles or no more clothes that are possibly toxic, right? But if you try to do everything all at once, it's going to be so overwhelming that there's no way, but every single step is going to make a difference. But it's
Agreed.
just it is, I think I come back to that all the time, is that you, at the end of the day, you have a choice. Like, do you want to keep feeling really bad and be dependent on medication that is only treating, really it's only treating the symptoms, it's not the cure, it's symptom management, and then you're adding on more and more symptoms that you have to then manage those symptoms as well.
Yeah.
I could rant about this for hours, Dr. Eric.
No, I agree. We're definitely on the same page. So, I mean, yeah, I can't agree more than what you just said.
Well, why don't you let us know how we can find you online, because you do a lot of online consultations. So I think anyone dealing with thyroid issues and looking for help in that area, like, I'm sure they're going to want to know how they can follow up. So let us know, where can we find you? What resources do you have? Give us all the goods.
Yeah, thank you. Thank you so much. So my website's savemythyroid.com, and you could I have a podcast also, Save My Thyroid, and if you want to work with me, there's either click on work with me, also workwithdreric.com. But and then also my books. I have three books. Again, two on hyperthyroidism, one on Hashimoto's called Hashimoto's Triggers, and you could find those on Amazon. And also have a newsletter, Healthy Gut, Healthy Thyroid, which you could check out by visiting savemythyroid.com/newsletter. And those are probably the main places where people could
I
find
love
me.
that URL. Easy to remember,
Yep.
savemythyroid.com. But we will also link to it in the show notes, just in case you can't remember that, so you can look there as well. Well, Dr. Eric, thank you so much. This was very informative. I appreciate you being here today, and just have a great day.
Thank you. You do the same, Ruth.
Thank you. All right, guys, that about does it for this episode. Remember that you'll find the link to Dr. Osansky's books, podcast, and website, as well as all the other resources we talked about, in the show notes. So be sure to check that out. And if you know someone else who's been struggling with thyroid issues or hormonal chaos, please be sure to send this episode their way. Then be sure to subscribe to the podcast so you'll be notified of future episodes. I'll see you back here for another new episode very soon.